All right, I think we can start now. Hi, everyone. Welcome to this session Without Borders, Within Boundaries, learning how to deliver aid in the light of a climate emergency. And thanks for being here, everyone online and in person. My name is Nishanie Jayamaha. I am the co-coordinator of a long name now. Secretariat for the Climate and Environment Charter for Humanitarian Organizations. And I am happy to be here today with both Bruno and with Stephen, both signatories to the Climate and Environment Charter. So quite happy that MSF and the Climate Action Accelerator are both signatories, which obviously says an important aspect of really prioritizing climate and environment action in humanitarian tech. So, which is why we are also here today to really look at what does this mean in terms of delivering aid. This session, and maybe just for a little bit of housekeeping and tech, Sam will be sharing some information on the chat. For those who are joining online, this session will be held in English. So for those who are joining online, FYI. Yeah, so to maybe frame the session where we're here to share a little bit of the key points from the chapter on climate in MSF Switzerland's recent published book, which you can see on the screen. Humanitarian Myths and Hubris, a critical self-portrait from Médecins Sans Frontières. I was just telling Bruno, it's really important that organizations like MSF and others are looking at things critically and really self-reflecting, not as just organizations, but also looking at the systemic challenges that we're facing and saying, are we doing the right thing? How are we going about it? What do we need to change? What sort of how do we be more fit for purpose, right? And I think this is something that we all need to do, and this is the time to do it, with also various changes in the funding architecture, humanitarian reset, etc. So maybe just to kickstart the conversation and just to introduce our panelists and our kind of session, we'll be talking about the climate piece on this particular book. And we have both Stephen and Bruno here today. So Bruno is one of...
Skip the bios, just
yeah.
like 3 words each.
I will try. Yes, I will try. Apparently the bios are not right. So
No, but I mean, it's a long story.
I know. Anyway, so one of the authors is Bruno and of the climate chapter. And so we're happy to have you here today, Bruno. Bruno is basically the executive director of the Climate Action Accelerator and has been involved in medical humanitarian action for over 20 years. And you've been in MSF for 17 years. So it's interesting that you've also been a co-author of this. I'm not going to go into too much detail of your background. Stephen is the outgoing general director of Médecins Sans Frontières Operational Center, Geneva. So you've been on the job for 6 years, I've been told, and you've been in various parts of MSF in the field and in other hats as well, right? So I'm just going to keep it to that.
Perfect.
Yeah, so we'll be basically having a little chat and trying to unpack about the chapter, and then we'll be opening it up to you both online and in the room for a Q&A, whatever you want to ask them.
Donc, tu m'as dit que tu voulais refaire un petit point.
And I'd ask everyone online to mute yourself, please, if you can. Thank you so much. Let's dive into it. And my first question is actually to you, Steve. Yeah, perfect. I'm going to put you on the hot spot. It'll be good to set the scene a little bit, because I think when it comes to health and humanitarian impacts of climate change, not the whole of the humanitarian sector is actually quite aware of that, I think, because I think health sector works in the health sector. We're all siloed in our approaches as well, I think. I know I understand some parts of the health sector, but not everything. So I'm sure we have an audience that would be interested to also understand a bit more. What are you seeing as changes on the ground that's happening right now in terms of the climate crisis and the climate impacts we're seeing, and especially with the communities that we're serving, and your medical teams, because we need to adapt, right? What are these challenges you're seeing, and what are you seeing that are facing the medical humanitarian aspects of responding to the climate emergency? Over to you.
Well, I'll start it, if you don't mind, maybe 15, 20 years ago, when communities first started to tell us about the impacts climate was having on their livelihoods, mainly, but also on their mobility, including having to be displaced from their communities because their farms weren't able to produce what they needed after 2 or 3 years of successive impacts on the climate, which then caused them to relocate to the cities. When they relocated to the cities, they turned into a new level of vulnerability. In places like Latin America, they fell under the violence with gangs, and then ended up taking the road moving towards the U.S. But we didn't record it in that way. We just recorded that these people were on the move and they were extremely vulnerable, and then trying to respond to their needs as they were in flight. And I'd say the same is probably true in North Africa, where if you sat long enough with people, they would explain many more reasons of why they were on the road, rather than just going to find money in the north or et cetera, and the violence and the everything that happens to those communities once they're on the move. Even if they started off only as an economic migrant, they then end up under the control of traffickers or gangs or others, and suffer in many ways, from sexual violence to abuse to torture to endless. So we've actually known for a long time and haven't put it into words, which is rather frustrating. But what's positive, and it comes out, I think, in Bruno's book chapter, is that we're not necessarily slower or dumber than everybody else. It took a while for the institutions to take all this information on board, to decide that it was their problem too, not just somebody else's problem. Because at the beginning for us, it was our image of ourselves is that we are just these frontline emergency responders, in, out, fast, and save lives. The reality is we do a lot of other things over decades with communities, from HIV/AIDS to street kids to working on long-term disease and accompaniment in many places where people fall through the cracks. But we didn't understand how to translate that, I think. And we spent probably 10 years translating operations on the ground that had a climate link. We even published, I think now 7 years in the Climate and Health series in the Lancet. Many of our own doctors didn't read it, or stayed with their own ideal that if we were going to also work on climate, that would take money and time and resources away from this emergency end of the response. So as medical people, they were like, yes, of course, those concerns exist. Those problems are there. That's somebody else's challenge too. And probably about 7 years ago, that communication and that conversation evolved to the understanding that we, like any other organization, especially from a principled stance of doing no harm, we have a responsibility to look at our own environmental footprint, also how to adapt, and we'll talk about that later, of how to be fit for purpose tomorrow. But when we fast forward that to now when you talk to communities, it's a tragic series of climate impacts that are over and over and over. And what we see from the medical angle of that, first, you'll see in many places multiple storms, people's houses destroyed, their livelihood. It's starting to impact the community resiliency capacity. We have stories from Mozambique where villages are telling us, like, my house was destroyed twice in the last 9 months. If it happens again, I don't know how I can deal with this. And so we've adapted those programs to work on the things that the communities need in order to be more resilient, which then also affects what we're seeing medically, which is a rise in climate-sensitive disease, a rise also in non-communicable disease, because the vectors are also disrupted, and a disrupted or a stressed vector means it transmits more of whatever. And so we're having to tackle that. And then what we see now and what we've documented, which we didn't understand very well before, was that when there's a climate shock, you end up with some of the same disease patterns, regardless of what that climate shock was. So we've all associated a cholera outbreak after a big storm. And it's pretty obvious why, because sewage goes into the well, because but we see that exact same cholera pattern come out if it's a severe drought. And now we know that, so we prepare it ahead of time. And then following those issues, you end up then also with nutrition issues, which always go together, a disease in under 5, but when you have a climate shock, so. And we now are documenting in a number of areas where we have used to have a seasonal malaria peak. We now have year-long malaria, which much higher levels, and then a stressed population also becomes more susceptible. So we're seeing and hearing and writing, and now you don't have to convince anybody of those effects on the community that are right now, not just about tomorrow.
And so you're basically internally as well within your teams, you're seeing that there is a really better understanding of the interlinkages between climate and health.
There's not only a better understanding, but we also have better tools. We have a transformational impact fund inside the organization to help us move along. And one of the things that came online about 5 years ago is a project that collects all of the data from all the surveillance organizations, weather mapping, disease burden, everything. And you can upload your question one day, and the next day they send you an outline, a couple of pages long, about what you should do in your community. And that's been used in a number of ways. In some areas, they'll be able to tell you the historical flooding pattern for the last 20 years. So I'm not going to build a clinic in the wrong place. That's only a once in 10-year storm that nobody remembers.
Exactly.
They gave us information during a locust outbreak in Somalia with the climate patterns, the moisture patterns, and they could say from that, of these 3 strands of locust, this one is likely going to make it farther and reproduce, and these ones are probably going to die on their own, which you'd never be able to tell, judge, or know. From our medical data now, in some places where we have historical data, with machine learning, we can predict the height of the malaria peak, and even then be able to bring extra supplies, train extra people, because we know when it's going to happen and we know what the malaria burden is going to be 3 months out. So we now also are better equipped to be able to use, there's so much information in the world, but now we're able to use that, not systematically everywhere. Our big problem is we've piloted a lot of things in a lot of places. We have yet to scale all of those solutions across all of our response. So some of our front end response probably looks the same way it did 20 years ago, frustrating as heck. And other places, we're starting to put these pieces into place and really starting to move the needle.
And I'll come back to you on that a little later. And maybe Bruno, just to actually follow up on what he's saying, if you look at the broader humanitarian system and the challenges that we're facing in terms of climate impacts and multiple layers of conflict, fragility, economic crisis, debt crisis, food insecurity, now we have the oil issues and what's happening, which also is impacting the rest of the world, which is not just the humanitarian context. Maybe if you could kind of give a bit of an overview, what are some of the challenges that we're really facing as a sector in the first place? And then as humanitarian actors and organizations, what's our role in terms of responding to the impacts of climate change? I mean, if you've been in half of these conversations, we know it, but in a way of like really unpacking what does that mean for actors like us who are on the front lines, be they local, international, etc. But what's our real role that we need to now take on? How can we better incorporate climate and environment action into our work? Because that seems to be a challenge. And then to also the health aspect, because that's kind of the conversation we're having. But I'll leave it to you, and you can kickstart that thought process. Yeah.
Thank you, Nishanie. So I'll build on what Steve introduced before. I think if we look at the challenges that the humanitarian sector faces on the climate and biodiversity crisis. It's not only climate. I think, I mean, the first thing is that everything that the scientists have predicted since 30 years is basically unrolling in front of our eyes. So whether it's on the temperature rise, whether it's on the impacts on human societies or ecosystems, etc. And what it means is that what they're predicting for the next 30 years is highly, highly likely to happen in front of our eyes. So we know we're going to reach 1.5 degrees warming, which was the threshold of actually safety.
We passed.
So we're basically, we've passed it for the first time, and we're going to pass it basically as an average in the next 2 years. We're going to reach 2 degrees global warming in the beginning of the 2040s. We're on track for 3 degrees. These are averages. Planetary, it means on land, it's 4.5, so it's 50% more. It means in some regions, you're talking about 6, 7 degrees warming. So that's the real, that's what we basically, what's being unrolled in front of our eyes in the now and in the years to come. This is going to put whole regions on Earth basically at risk in terms of livelihoods, in terms of access to food, access to water, etc. So what Steve just described is basically, you know, the symptoms of this progression, which are basically going to increase exponentially. And I think the challenge for the humanitarian sector is basically how do you actually face what are the operational consequences of this situation in terms of programming. So what can you anticipate? How can you actually protect capacity to respond, expand, while being extremely aware of the limits? Because basically we're talking about changes on such a scale that a big part of the response will actually not be humanitarian. It's going to be public health systems, private responses, etc. So how do you actually face such a situation? How do you do that while listening to what the scientific consensus is asking of every actor in society, which is to bring down emissions rapidly? So what are scientists saying today is that the practices of society are fueling the crisis, linked to basically demand for oil and linked to basic agricultural systems, etc. So how do you actually face increasing needs while acting on the way we operate, the operating model?
Current operating model.
Yeah, and how to do it at the same time. And then how do you do it in a context where indeed you have geopolitical instability, which is arising fast. You have an international order which is being deconstructed under our eyes. And the humanitarian budgets are being cut almost by half in less than 2-3 years. That's also what's happening right now. So the end of the day is, what's the pathway which makes humanitarian assistance more relevant in terms of assistance to populations, which actually responds to the duty of responsibility on climate and environment in terms of practices, and which is manageable within very constrained resources and budget cuts, etc. So what is this pathway that actually allows us to navigate the challenge?
And to that, Bruno, and I think you picked on a few things of how we're very dependent, and now in this context we also see, everyone's so oil dependent, prices are going up, for example, and there are these ways of working that we as a sector is learning about. How do we reduce our emissions? How are we being more environmentally sustainable in our operations? And you've worked with the health sector quite a bit with the Climate Action Accelerator and others on putting that to like looking at it in a different level, and with local actors as well. So I will come back to you on this question, but maybe to you, Stephen, as MSF, as a big player in a sense in this game, if you could call it. How have you as an organization been making these changes, and where have you seen maybe the kind of the cost benefit analysis of it, or in your operations, have you seen, okay, if we've done this, this is kind of actually going to be better, and we've seen the reaping the benefits, because this is what everyone's asking, donors are asking this. So I'm going to ask you on that first one, and I'll come back to you afterwards. So.
Well, it was easy because we just reached out to the Climate Accelerator. They helped us build a roadmap, so we can take it up now. But that is what we did. We're just now rolling out a measuring tool, which will allow us not to use money saved as a quasi indicator for carbon saving. So after this year, all of MSF will be using this tool, which will tell us exactly our solar output, exactly our fuel output, and then we'll know exactly what we've saved in terms of CO2 as well as in the next area that's been it's linked to supply, but it's in greater efficiency of largely our warehouses, which are huge wasters of whether it's electricity or fuel or whatever is powering them. So that's with the operation I run, I think we're at 85% of our warehouses have all been insulated. So better capacity, some have been solarized. In I think 60% of our missions now have some sort of a solar solution for a piece of their work. It's not comprehensive, but where opportunity comes instead of challenge, where we made the most advance, is in places where fuel has been either expensive or very hard to access. So in places like Yemen, we have full solar almost everywhere because of this fuel supply challenges. So if we turn around the challenge part to the opportunity part, high fuel price is actually a great opportunity and a great way to encourage investment. One of the difficulties is that where we know we're somewhere and we're there for a long time, then you can budget that way. But it's on the emergency side, they're not budgeting on the savings they're going to get 3 years after installing XYZ. And there's sometimes a reluctance to install solar if it's going to be a place where we're not sure about our access, or we're not sure about women of the warning parties to respect the facilities, etc. So it's always this little push and pull. But what we did at in Switzerland here was for 5 years, we put a special amount of money aside. We put $10 million aside. But we were able to track what that would, what those investments would do, how we would move the needle, and also what would the outcome savings be. So we know now in terms of how many thousands of gallons or millions, whatever dollars that we saved. So that's gone pretty well. It does run up against challenges, as I just discussed, when you have an emergency mindset at the front end. Yeah. You're like, if that XYZ is more expensive to start, then I'm helping less people. And in order for us to get our minds around this and incorporate it, we had to say that we would not save a life in order to save carbon. Otherwise, we wouldn't have been able to bring everybody with us. But more and more, people are seeing that then makes the system more resilient, does save money, is the right thing to do, and more it's becoming standardized. There's still issues, especially when it comes to supply, for example. If I order any kind of a solar install, any kind of a generator that you'll need, it doesn't come with an automatic solar pack. You have to, for example. And the solar solutions, often we like to do it ourselves. When most solar solutions now are local in the local market, but then you have to work out how it's going to be maintained, et cetera. So that's on the supply side. We've also done eco driving, which reduces traffic accidents, also saves fuel. So there's a few different bridges. Eco driving. So the drivers all learn how to not hit the gas too much, shift the gear sticks. It sounds like a little bit pokey, but it all adds up to be a damn fine investment, and then safer. And if you have less traffic accidents, you have less problems with the community. It all kind of rolls itself nicely together. We've done quite a bit of work on trying to reduce single-use items. Yeah. There's still a long way to go, but if you reduce single-use items, A, you're not buying something and shipping it in, blah, blah, blah. B, you're not getting rid of it when it expires. And we do a lot of medical procedures that we don't even need to do. In Lebanon, we looked at reducing rubber gloves. And just through training and when do you need them, when do you not need them, we reduced in 6 months, 30% of the consumption of rubber gloves. So this year, the idea is to scale that program out to all of our missions. So you imagine if we reduce the bulk of what we purchase. We looked at single-use masks and replacing them with multi-use masks.
Oh,
But the new masks there are not quite up to the standard, and that's a medical challenge because our pharmacists are going to want something to be standard qualified in Europe in order to use anywhere else. Even if it's a 98% better solution, if it's not 99.9, we're not going to roll it out. But there are new products coming. Also through the Transformation Fund, we've looked at 10 other single-use items. Some of them that we use 7 million little medicine bags a year, little plastic bags for your medicine. Everywhere else in a clinic in Africa, they just wrap them in newspaper and give you something, right? But our guys are like, hey, it's got to last this long and moisture, and we tried to build these little bags, but so far they decompose a little too quick. But within a couple of years, across the whole plastics, and I hate plastics, but there will be real degradable plastic that is not plastic, that is other types of alternatives. And I would say, like within 5 years, 10 years, you should be able to make a syringe that's made out of plant-based stuff. Because we really work at it. And there are some of the challenges is that we're not getting together as a sector to do forward purchase. So we're having a lot of trouble on the supply side, mainly with the manufacturers that don't want to change what they're doing.
And I'll come to you on that. And Bruno, then that's actually a good segue to you because, I mean, with the work you're doing with CAA and you're seeing kind of this challenges that the sector is facing in terms of supply chains and procurement and working with suppliers and organizations like MSF have a leeway because they're big, they can actually have a good, conversation with the supplier and say, well, this is what we need. You need to probably, we want that produced like that perhaps. So, but I think, so also what Stephen mentioned, like, the Swiss MSF has put away 10 million francs or dollars, right? Now that's a lot of money for an organization to, the Swiss MSF can do it. But what about others? What's the trade-off that you hear from humanitarian organizations saying, oh, it's a lot of money up front to solarize, to look at all this procurement, to put in place some of these systems. But what do you see as these opportunities in the sector that can be building on what he's mentioned to kind of advance? But what are the trade-offs and what should we not be trading off is the question, right? Sure. The dilemmas that we've been talking about in this book and in this chapter.
Yeah, sure. So of course there are trade-offs in this decision making. I think the question is, where are the real trade-offs and what are perceived trade-offs? And there's a big difference between the two. Okay. So first of all, so levers for action are many, and there are many areas where action comes with actually either efficiency gains or savings or financial neutrality. And then you have a few areas where you actually need to invest and you're going to have extra costs. When we worked with, we did a capitalization exercise on about 10, 12 humanitarian organizations in the roadmap setting. We saw generally, the cost of decarbonization, etc., was usually much less than what people expected. Depending on the organization, overall, it's between 0 and 1%. And because you have areas which create big savings and others which need investment. So I'll just speak concretely about levers. So levers, for any service organizations, I would say, like the rest of society, has been traveling for many other reasons for internal needs. So yes, there are important margins to rationalize this. Again, it saves money. It saves money. So there's no trade-off here. It's about how do you make it acceptable internally? How do you define a clear policy saying what's actually legitimate travel, which Supply is quite different. So supply is like 2/3 more or less of the footprint of organizations. And so what Steve mentioned about medical practices, for example, is very important because supply is about production of supplies and it's about the demand of supplies. Okay, so what organizations control partially is the expression of their demand. So we see very clearly that depending on the protocols you use, depending on the practices. We have an anesthesist working with us at the Climate Action Accelerator. He often gives the example of the difference between general anesthesia and local regional anesthesia. And he shows the difference in terms of basically waste produced, emissions related, cost and benefit for patients. It's overwhelming. I mean, it ticks the box on almost every aspect. Patients,
Reduces
cost,
medical error.
exactly.
reduces-
So these are just examples, but for every organization, you can actually question some of the practices and go for alternatives, and it has impact. When it comes to choosing products, so the first obvious choice for an organization is privileging supplies that work on low carbon energy. So you don't choose the product. It's the same paracetamol. It's the same. It's the same medical equipment, etc. It's just that it's produced by a factory which is working on low carbon energy. So this is a no-brainer. These choices can already be made, but it means procurement teams have to be able to integrate this in their criteria. Okay, so it's not from one day to another, but it's fairly possible. And then you have all the field of alternative products. For example, UNHCR has been working on blankets recently. You see that for blankets for refugees, you can have better quality blankets, less emissive and less costly at the same time compared to what's being used today. So simply, working on maybe 20, 30 top items of the sector and looking at these alternatives consistently over, 3-5 years, a huge difference can be made. And so I really want to pass a message that actually there's a lot that's feasible. There's a lot that's feasible without trade-offs on, this is not at the expense of people. It's not true. So it's actually often better for populations that are supported, and it's workable.
Thanks, and that's a really good point to raise, and Steve, just to maybe kind of pick your brain on that is with the reset. That is what we're looking at, like this efficiency, cost gain, and all the buzzwords that we've been hearing to see how in a system can we be more efficient in a life-saving context, which MSF works on, but also making sure that we are looking at resilience, right? We're looking at resilience to climate shocks of the communities we work with, which are long-term, challenges. It's not a short-term work. We are in places long-term, but now we've been hearing today at the opening, we heard, local organizations say that they're pulling out of Cameroon. The sector is winding down. There's high priority countries which are going to be focused on. So we're hearing all these challenges where normally there needs to be some form of long-term recovery process going towards development, handover. There's no one to hand over to, perhaps. I don't know. I mean, that's what I'm hearing quite often. So my question to you is, how do you look at that localization agenda, which is how do we support local actors? And you talked about that a bit. It is not our job to do something. It's not the humanitarian. We have to hand it over to the medical, the country's medical system. So if there's no country medical system, how do you do that? So over to you.
Let's try to hit the principle first, and then I'll tell you what we do.
Perfect.
principal problem with a lot of our long-term folks is the ability of the way the MSF runs itself. We set aside about 10 to 20% of our staff, of our goods, of our money. It's in the box of what we don't know is going to happen. And the only way that we can do that is to review all the programs that we already have. And we have to make a triage choice where we stop programs which no longer meet the emergency threshold. So people are still dying. System still doesn't work. Lots of poverty, all kinds of things. There's a need for somebody to be there, but there's nobody that wants to be there. And we have to stop that program. And in order that we can do the frontline stuff that others can't, and to live up to our mandate. And so when you try to introduce concepts of resiliency, of localization, of all of those concepts as a whole, nobody's against individual pieces of it. From a principle standpoint, you would then end up in the discussion of, well, what is our job? Are we there to help the most emergent and the greatest risk? Or are we there to construct and build a system that people have been working on through development plans for 30 to 50 years and have not succeeded? We're not those experts. So you can very easily, just like, is it green or not green? Well, you can get caught up in your principle bubble. In fact, resilience is one that sets lots of people off. It's very interesting. But in practice and in reality, we have a number of pilots where that's exactly what we're doing. And the one thing that we've agreed on as a movement, that's kind of a new principle, but it's not up there in the box, is that we are going to be better partners. And we need to be better partners in order to respond to what's going on today, as well as what's coming. And there doesn't seem to be any argument from anybody I've known on that. And so we are trying to work much closer to ministries of health, and in many places, much closer to communities. I'll give some examples of that. I mean, we have a whole nursing training program that we train nurses in places where there isn't a nursing training program, and ensure also that there can be men and women nurses, not just men, because that's what people wanted before, and give an accreditation and leave behind then a whole skill set level of community care. And we've been working for a number of years, much more with community health workers, giving the tools to community health workers so that they can identify malnutrition, diarrheal disease, and respiratory health, and treat them at community level, and then only be in secondary level. So we're doing a lot of these things, but we wouldn't call it through those kind of names, because then it gets everybody very excited. What I'm excited about is some of the partnerships that we're doing at OCG right now. One in Madagascar, where we've partnered with a local community organization. We've partnered with an environmental organization that works on livelihoods and rainforest reforestation, and built a program together, but not by the books of how we would build a program. So that the medical part that we've built, we build it to be more sustainable, more long-term, less impact, not treating all of the things we'd love to treat. The focusing on the main issues that the community has reported. And then our teams also stay there, and they help respond to the ongoing climate shocks, etc. The other guys work on changing the livelihood so the community is more resilient front of those shocks. So that can involve moving some of their production a little bit away from areas that are too much on the coast, or more organic farming. They also get them different types of livelihoods in growing seedlings that then people go to the rainforest to replant, which doesn't actually restore the rainforest, but it restores the link of the community to the rainforest. But as a partnership, then we work on building a more resilient system. We put solar panels and other amenities in the health system itself, so it's more resilient. The other organization does their part, and the local organization is taking on many of these roles so that we're not substituting and leaving capacity behind. That's a small pilot. It's not changing the world, but it shows what we're able to do despite the principles in many different places. And there is a lot of opportunity. There's a lot of interesting things going on. That the difficulty would be to the same problem we had before, is how do we then get that ingrained in the DNA of the organizations? That's how we work. It doesn't affect our principles upstairs, and we scale it in many areas where it's needed. And then we're looking at how the organization needs to be more fit for purpose tomorrow. So on that, we're looking at these climate shocks related to health. We're looking at new tools for the toolkit. Dengue, we see spreading all around the world. We don't yet have a good vaccine, though there's one in development. We've worked with a company that puts a gene into the local mosquito that then doesn't allow it to carry dengue. And done this through a community approach over months of discussion with the community, trying to lower the cost of, it's called Wolbachia, it's very expensive. So we're trying to lower the cost, so it could be a community solution. We're looking at other climate sensitive diseases, how we can even use local vector control on schistomiasis and other things like this in many areas. There are little shrimps or other things that naturally can eat those bugs. Yeah. Well, is there a way that then you could work with an organization that can work on a livelihood approach where all the rice paddies will have a little shrimp farm on the side and the schisto bug, and then we do the water. So there's lots of interesting things coming, but we still have a lot of way to go. And what really is the harsh reality is that the teams that are working on each of these programs end up having to chase multiple hurricanes every year, multiple droughts, multiple other disease outbreaks, insecurity, everything else. So then it shifts the attention from that piece. It works a little bit more in the old-fashioned way, where then you bring a whole lot of stuff, a lot of people, and you put that fire out, which is very important to save lives today. But then when you go back with the community partners, they're like, hey, you've got all these other bells and whistles, and we want some of this, some of that, and that kind of disrupts the little holistic resiliency community building approach. And in some places in Mozambique, we ran into political difficulties with what was going on in the country. We had a cholera center burned down, and we'd been there for 5 years working on non-communicable diseases, and the space to be able to work there is evaporated. And it would be too risky to work on an NCD program. It might be not too risky to work on a war surgery program. So it's very difficult in this current world with the growing insecurity, with shrinking resources. And then when we look for the community, the other partners, whether they be local, they suffer the same issues. Our local partners disappeared in Mozambique under persecution, in jail. So it's extremely challenging. And then the other organizations that normally would come in and help and could be a development partner and last longer, they're suffering these cutbacks. So it is a challenging world to juggle all of these things at the same time. That's the real truth of it.
And yeah, I mean, it's really interesting, some of the work you're doing in Madagascar and what you've mentioned in, some of these toolkits about, and technology. And I think this is where you mentioned earlier, and I'll come back to you on that question, on that point a bit more. Bruno, to the effect of what we've been seeing as MSF kind of, changing their modalities, but it's also a mindset shift, a behavioral shift, right, for organizations. And I think my question to you would be, have we really as organizations kind of been able to look at this critical thinking mindset shift and leadership shift? I mean, Natasha, who's my code coordinator, is in the room, and we work with, we have 500 signatories to the charter. When we talk to some organizations, it's a person in the climate team who's super interested in saying, oh, we need to do this. We need to have more nature-based solutions. We need to really look at our, footprint, etc. But it's a struggle at leadership level to really make the change. Sometimes they're like, can you talk to leadership? Can you make that push with the leadership? So can I maybe put that question to you, and what sort of challenges and changes should we be looking at in that way as well?
No, sure. I think So to answer your question, I think we're clearly not there yet.
Mhm.
So we shouldn't hide. In fact, I think what has grown a lot over the last few years is awareness. It's a general commitment. So signing the charter, taking general commitments, etc. What you have is within organizations, you have groups of people who are moving. But we still, a lot of organizations are still finding it extremely hard to mainstream within, their approach to programs, within their functioning, etc. And I think in the particular situation we are in today, where lots of organizations are facing, short-term survival issues. Some of them are losing 30% of their budget, 50% of their budget in sometimes 2 years. So of course, what it means that the horizon is suddenly becoming very short, and everything that's beyond 2, 3, 5, 10 years becomes very, very distant. So the question becomes, and it's partially based on a false understanding of where the trade-offs are, because it's seen as environment in these crisis moments is seen as a bit the cherry on the cake. It's what you do when you have the time and money, basically, which means there's still not an understanding of how deep the crisis is and how it's going to impact both needs, ways of operating, margins of maneuver for organizations. And I would argue today that collectively we need to refocus on what are the operational, the economic benefits of the transformation, because what you can see is that if organizations don't change their operating modes, they're going to lose money, because dependency on fossil fuel means it's costing a lot and more. We see it today. Prices suddenly surge, everything costs more. You basically lose capacity of maneuver. Okay, so it's about being able to do more assistance later. The question of localization. So I fundamentally believe that the answers to to climate challenges are first and foremost by national actors. I mean, I visited twice Bangladesh, where you see the strength of certain policies in reducing the number of victims linked to climate shocks, etc. It's almost entirely dependent on the strengthening of their own response, etc. Humanitarian assistance usually comes in last resort, where you have collapse of capacities, much more than anything else. So I think the issue of leadership here is how do you make the space and level of attention of top leadership simply to have a regular overview of what are the opportunities of linking environmental responsibility and humanitarian effectiveness, how to understand that you can actually free resources on one side to make investments on the other. And here, I think it's part of the discussion for the humanitarian reset, because I'm pretty pessimistic on what international humanitarian assistance can become in a few years down the road if there are not these fundamental shifts. And reinforcing local capacity is it's the only way of actually responding to needs which are going to outgrow even more than before the ability of the international humanitarian system to respond.
And on that,
Can I add something to this?
sure,
Because
please.
I have no quibble with what's just been said, because that's the reality. There's a couple of challenges, and then there's a great opportunity that could help us. The start one is that the UN system itself still doesn't really have any kind of serious climate target.
Yeah.
So if there's no roadmap and no target, they're not even going to be aware of what they could save and how they could do it. And that needs to come from governments to the UN. It's not just UN leadership. If governments don't do it, it's not going to happen. Then we have another regrettable swing, especially to the localization agenda, is that in all these cuts now, we've gone the opposite way of funneling money into development and less into humanitarian and to government. We're funding more into humanitarian because we are failing at all those other levels. And Bangladesh and Philippines and lots of great places like that can do all exactly what you just said. So many others simply cannot. Small island states just don't have the capacity in government. There's more programs for small island states than there's capacity to do. In fact, the Green Climate Fund, and this is where a lot of people should look, is sitting on about $2 billion that they have not been able to put into the ground. They have a backlist of about 10 years of things to check through. They need implementers. And those implementers don't just grow on trees, but there's a lot of people that have their funding cut that should get their gear and get over and give them a hand doing that in a lot of these places. That would be a good little Band-Aid for now. But then we have the opposite problem of where the money is going is now with all kinds of other strings attached, very real politique, and not necessarily going to be used in the right way. And if we look at places from Yemen to Sudan, where you have the world's largest humanitarian emergency, man-made internal conflict, you certainly don't have the infrastructure, the governance, the everything else to take care of it. So I think there's probably a way to make a map of the world and say, hey, this 50%, let's get going, to exactly what Bruno said. But then we have to find a way to have governments put the footprint on the UN reset, because it's not in there. And it would be a huge bloody savings. And there's a few things linking them together, but mainly it's governance at the top. It's not the operationally on the outcome yet. But yeah, it's, and for us, what we're trying to do is in order to get around all these challenges internally with our own optics on saving lives or doing green, is to look at the alternative green fundings, and there are a lot, and see how we can build ourselves into that a little better. And that will thread the needle right back to the resiliency and everything else you just mentioned, because most of those funders want to help you on your CO2 reduction journey. They want to invest in mitigation, but they also want to invest in adaptation.
Yeah.
And so if you hit the three triangle, and there's a lot of forward-thinking financing out there, a bunch of forward-thinking governments. If we go at that angle, I think there's a lot that can and should be done, and would save money, save lives, and leave communities more resilient going forward.
And on that, I'm sure there's quite a lot of questions out there from the audience and those online. If someone can check if there's any questions online, and nothing at the moment. Okay, so those online, if you have any questions, please do put it on the chat and we will pull it out and pose it to our speakers. And in the room, anyone in the room who has any burning questions? If not, I have quite a lot.
Or solutions, or
Oh yeah, whatever. But,
challenges.
anybody in the room?
Come on, don't be shy. Somebody break the ice.
I'm sure someone has a question and doesn't want to put their hand up.
Maybe in the meantime,
Okay, we have Sam.
Yeah, I mean, I'm from Climate Action Accelerator, so no one, yeah, I can get
Speak up.
started. So we've been trying to engage with
Speak up.
the UN system quite a lot, and I was wondering whether I mean, we're trying to engage at the highest level, but I was wondering whether or not you feel that there's an opportunity for more learning of exchanges and best practices from all the experience that you've gathered over the years to these UN agencies, and whether, yeah, I don't know if there's any mechanisms in place or if there is any opportunities for more.
I think more sharing is great. I think I would go after 5 or 7 governments that care and have them put their finger on it to the UN, because then they'll fund the next thing. They'll make everybody sit together.
Yeah.
They could come up with their own inter-UN solutions between how many agencies that they have, and they're having to look at that as we speak. But they're looking at it in a finance, and they're looking at it in politics, internal UN politics. I have not seen very much on the looking at it from a, hey, we would be more fit for purpose tomorrow
Yeah.
if we put a green agenda in here and funded it. And if they were asked to by some donor countries, and those donor countries were willing to put their money on the line, the UN would do the dance, and then we'd all be better off for it. But I don't think it's going to come from the UN leadership on its own without a push.
I think we have to be. I think we have to be realistic on what we can expect from the UN system in this particular context. I mean, to be able to reform themselves, like having targets or having totally different procurement systems, etc., they need a certain level of consensus between states. And we know, for example, the US administration last year has sent letters to all UN agencies threatening them on simply, having climate as an ambition. Okay? So that's the reality we're in. Right? You have UN agencies who are threatened to lose all funding, etc., if they do a certain number of actions. And then you have other states which are, of course, pushing, supporting, etc. So I think what's realistic is to expect today coalitions of the willing, or enough consensus on really pragmatic measures like supply chains, because supply chains you can both green and make it more efficient and save cost. That can be a platform to actually do better. For example,
you have to rebrand. You don't call it green nothing.
Exactly.
You just say this is about fuel savings and improving the supply chain,
Efficiency.
and then nobody's going to argue. And it's the same with a number of programs on SGBV, on many other things that people aren't supposed to do today. If they get rebranded into a different bucket, then they're not going to raise the flag, and then there's money and advances to be made. But we can't come at it from, we're going to green your organization. That's not going to fly today.
Any questions online or any in the room? Yep, we have Natasha.
Hi, I'm Natasha. I'm with the Climate and Environment Charter. My question is about very early on, Stephen, you mentioned there's a number of tools that MSF is using to help you do the work better and more efficiently, and using all sorts of innovations and technologies to try to do that. And I'm curious, for other organizations that might not have access to the sorts of resources to build systems like this, how can others access? Are these tools publicly available for other organizations to use? How can other organizations think about using the technologies that exist to, understand climate risk and impacts, and especially on the health sector scale?
There are a number of tools and organizations doing this, but most people aren't very linked into
Eh ben, vas-y, tu que pour me suivre un truc qui finit pas, je peux t'attendre, pas que tu fumes ta clope.
we could have simply just infused that now as having its funds cut too, but there are a lot of tools that people can use that are publicly available. We're a funny organization, so we like to do everything ourselves. So we built our own, if you like, but it also suits and serves our needs. But there is a lot available. It's about, I think what Bruno said is about the cultural shift, about using other things and looking at it in a different way, looking at things as an opportunity, not as a challenge. And then there's a pretty good roadway ahead if you flip the frame. But I don't think money is the barrier. And I want to speak more to it than I can, but in fact, the money thing, I've worked with CARE and other organizations where money matters in a different way, and you watch your accounts, and if you save $1, you get to re-put that dollar somewhere else. And that's a change in mentality, which a lot of organizations don't do. We certainly don't do that. If I install a big solar thing and save $200,000 of fuel, I don't get $200,000 on my budget to do something else. So that's a big negative incentive in my organization. But in CARE or in Alima that you guys worked with, it's a super positive driver, because they know they've got a grant from government X. It's $5 million. I'm making up the numbers. And if they front the fuel on that, and it's a 3-year program or a 5-year program, they know they're gonna be saving how much money in 3 to 5 years, and they know they can then reallocate that internal money, because generally on any contract, you get 10%, you can move around where you want. When they move that money around, they come up with savings that they reinvest in their program, or they hire somebody else, or they get the other widget that they didn't need, that they didn't have, sorry. So I think it's really the mindset shift that you were talking about, Bruno, and we've seen that with Alima. We went and had a little view of them, and they worked also with the Climate Accelerator. And their guys were just running with it. And then you didn't have the institutional pushback, which is what we were just talking about with the UN right now, and the financiers, right? It's about how you label it. If you label it, this is making your NGO more efficient and better suited to deliver programs and closer to whatever. We really, I think a lot of the climate talk, we all know what's going on. We all try to scare each other with how bad it is and how much you should do for tomorrow. I don't think that helps us anymore. I think it's just about seeing in each sector, in each place, what is culturally okay to do and to drive down that road. And then come back with the branding later, once everybody realizes it's a good thing to do. If I had to put resilience in my charter today, it would just, there'd be no way in heck. In fact, I'm talking out of school. This might be Chatham House. I don't know. Probably it's not. But I was working in Canada with MSF, and we did all kinds of things on DEI way back when. We're talking 15 years ago. I've only been here 6 years. 6 years when I got here, and we started to talk about DEI. We couldn't talk about DEI, and it was a very strange reason. The reason was what was sticking in people's brains. And we have probably about 30% of our staff are French. And as you go up the ladder, probably a bit more. So there's a real strong French culture. And they had outlawed race after the Second World War and the Vichy period. So race doesn't exist. So when I talk to somebody about how we have some biases and that you're calling me a racist, and these are smart humanitarian people that have been all over the world caring for people. They don't see colors in that kind of sense, you know what I mean? But we could not talk in that language. So we just rebranded the whole program. It's still called DEI, but the language within it was all changed. And then there was no problem. It was just, that's the barrier. So if I'm going at the front door today saying we're going to green the UN and that's going to blow up the US, I'm talking to one. You know, it's not helping. We have the clock's running out. Bruno's talked about it. So it's like, where is the flow? Go with the flow. And we have so many of these different buckets that we all lead with. I want decolonization. I want localization. I want green. We all want everything, and it would be a beautiful world. But we've got to go in through the crack in the door, and we got to go with the flow to get it started. And then we can add all the bells and whistles on through the case studies and through the internal communication, get to the leadership, and boom. That's my little diatribe, sorry.
Yeah, well, you know, I think getting an ideal mix is of course very difficult.
Yeah.
So I think what you need is many different ingredients to make the change. So you need courage, and that's very important because I see a lot of leadership teams who are not willing to confront the internal culture of their organizations, or don't dare to because it's like it is, etc. So it needs courage. It needs courage about stating what the situation is and framing the ambition. It needs being opportunistic, as you say. So using levers that are at hand and usually overlapping with other goals, whether operational, whether efficiencies, etc. It needs skilling up people, because part of the response is actually adapting the skills of people in the organization, supply teams,
Well, and partnership, which is what you guys helped us with and others, right? We didn't know how to build the climate roadmap.
And then it's important also to understand that there's so much you can do within the same model, but at one point it will have to shake the model.
Yeah.
So if you talk about footprint reduction or adaptation, etc., there's a lot that can be done within the same existing model, but you cannot go beyond a certain point
Yeah.
if you don't change it.
For sure. But when it's
And,
ready.
and that will be, that will mean tough choices. Because basically, if you want to, have more capacity of humanitarian assistance, you will need more partnerships with local actors, because or else, obviously, the response will be limited, and you will need to design your operations in a different way. I think every profession has also a role to play in identifying what are the practices they can change within that profession. I mean, there's a huge mobilization of medical professionals on climate and health and on practices. They have absolutely huge levers, and this means working with professional societies, etc. So I'm personally, I'm very optimistic on actually what can be done. But it's a fight. It's a fight, and this is not the moment for people to put it aside because of the geopolitical reality, because of the emergencies, because of the hostility to international humanitarian law. All of this is in the same bucket, and the reasons why climate action are actually attacked are the same as international humanitarian law, international solidarity, etc. So defending one is also defending the other.
That's a really great point, and I think Sam, there's 3 questions. Maybe we pick
So-
one or something
There are
that.
2 for Stephen, so I thought I might repeat them together. The first one is about what are the challenges that you faced internally during your journey to implement such an approach? And the second one is around sustainable freights. If you could expand a little bit on the work that you've done, switching from air freight to sea, and if you have any figures on savings. And then I have a few questions for Bruno after, if we have.
So on the logistic front, we don't have the exact number in head. We have the number. If they're interested enough to get it, we can get it to you. We're reorganizing currently all of our different logistic bases. We've also moved, I think, 15, 20 items, big, heavy, long-term items that we no longer bring to Europe at all. We'll bring them to a regional base. And from that regional base, it's closer to where we'll need it. And then it will go by ship to its place of distribution. So it's really a very promising area. Some of the challenges, I think we've mentioned them, but people believing that $1 in this is not $1 in the other. So life-saving first, green later. Trying to get around that by looking at additional funding that's green funding, dedicated funding. But what we've seen is if there isn't dedicated ring-fenced money, when you do have a difficulty or there is a big emergency or there's a bit less money, the climate investment is going to get shortchanged. And that's not good. So the money needs to get ring-fenced. It has to be a separate pot in my experience. And then it comes back a little bit to the conversation we were just having. It's I led an environmental organization before coming back to MSF. If it was up to me, we would have been 20 years into the future by now. So it's about finding that right balance of how do you bring everyone along? How do you go with the flow where you can? Try to change behaviors, try to change mindsets, inform, educate. Probably the biggest sticker that we haven't really cracked, and you mentioned this is one of the difficult ones, is on air travel. Because it's a core part of what we do. There is expanded reasons for travel, as Bruno mentioned, but it's also coming up against another principle because we're trying to globalize our organization. We're trying to give the same care to the staff that grew up and work and live in the countries where we operate as those that we fly around the world, which means that they also should be able to go to trainings wherever they are. They also should be able to travel to world jamborees and things of that nature. And as we care for our staff more, we've built in more trips home, more other reasons, more other costs. So it used to be you would go on a mission. That mission could last 6 months to a year. You never went home. Now you get to go home every 3 months, and that's a plane ticket back and forth. So and then you have competing priorities then, in treating people better, in being truly global and local, in being all connected. So it's not unsolutionable, but it makes the difficulty is that different leaders and different segments of the organization are attached to their piece. So we put in a policy on travel that said, national meetings no more than every 2 years, et cetera, et cetera. But then say I'm the training guy, and I'm like, yeah, but I didn't have a meeting yet. Yeah, but do you really need one, or do you just want one because it's easier? We can do it online, et cetera, et cetera.
I think Bruno has something.
Yeah, well,
to
I think what Steve is saying is really important, because what this shows is that what you're going to have is you're going to need a hierarchy of values to actually solve these dilemmas and trade-offs,
Yeah.
because of course an organization wants to develop its international workforce, and including localization, etc. But to do that, it requires support, interaction, whatever, training. And on the other hand, there's the climate crisis, which is also a concern and an imperative, etc. So the question is, in organizations, you're going to need decision trees to solve these issues, because at one stage, the question is what's actually the most important for you? Is it actually continuing to develop goals like the integration of the workforce at whatever cost it means in terms of expansion of travel? Or do you consider, for example, that, well, actually, maybe it should be done differently? So, we don't do any more, big international trainings, etc. They should be national or regional, close by, and we're going to train the people there to do it, basically. Things like this. So, and this is where comes, the changes of models, because basically, it is possible to do it differently. The question is, does an organization want to do it differently? And that's the real choice. And the same goes for, I'll give you another example of conflict of priorities on supply. Today, a lot of, whether it's in the health or humanitarian area, there's been a lot of efforts over the past years for regionalizations of supply chains, for good reasons, or production of generic medicine in India, in China, etc. Also for very good reasons, affordability, etc., etc. But what it means is that in some cases, not every cases, you're going to have a conflict, because what you're doing, if you go fully that way without looking at energy sources, you're basically increasing the carbon intensity of your products. So actually increasing the emissions linked to your supply chains. So that can be a risk, okay? So what you would want to do to compensate this is being much more discriminating between those producers, for example, in India, because there are some that are on renewable energy versus those who function on coal. So if you start putting criteria in place, you can actually reinforce a regionalization of supply chains, but on the condition that you privilege at the same time those producers that are making efforts on their energy sources. And so, there are constant trade-offs like this. The false, I would say, the false dichotomy is to think it's incompatible. It's not true. There are always compatibilities, but you have to make efforts to make it work.
And I think there's a question for Bruno.
There's another question in
the room. Anyone in the room? No? Well,
Otherwise,
online.
this is a question from for Bruno, from someone in Nairobi, from MSF. Is Climate Action Accelerator capable of mobilizing its membership to create critical mass to influence the primary humanitarian suppliers and service providers to transition towards emission reduction?
Yeah, so that's a good question. So I would say, are we today able to do that? The answer is no. Would it be needed? The answer is yes. What I think is, the issue of, there's a few items on which humanitarian organizations are actually a big I mean, they have a big demand on
Market share.
suppliers, yeah, market share. So that can be, for example, notably relief items, specific relief items. If a few agencies get together on specifications, they can change the market, okay? But that's for a limited.
Yeah, with forward
That's
purchase. And
exactly. So at the Climate Action Accelerator with others, what we're currently working on is for top relief items. But there's been a number of life cycle analysis. There's the question of how you turn this into specific recommendations for procurement teams. And there's a need to get UN agencies, the Red Cross, Red Crescent movement, or organizations like MSF, others. You need a critical mass to actually take up these recommended specifications and put them in practice. If you do that on basically 10, 20 items, and you get the few organizations that represent like 80% of the international assistance, you've changed the picture. It's a realistic goal, not from one day to another, but over 5 years. It's absolutely realistic.
But, I mean, plum peanut would be a good example.
So plum peanut would be a good example. Plum peanut requires clinical trials to find also different formulas, etc. It's a good example, but there are lower hanging fruits. I talked about blankets. We talked. I mean, there are
But plum peanut,
hygiene kits, things like this. You can change the picture in a few years.
on the plum peanut, I'm not talking about we are doing another thing on replacing the product, but I'm talking about the packaging of plum peanut.
Yeah, sure.
If you did your model, if 5 people went towards that manufacturer and said, within 5 years, we don't want it to be in some garbage, crappy package. We want it to be in a biodegradable package. They probably work on it.
Sure. But so we I mean, there was a big meeting in Lyon last year, organized by ECHO and the French Ministry of Foreign Affairs, all UN agencies, humanitarian organizations. There was a relatively good level of consensus on what needs to be tackled and what are the priorities. So I think it's about indeed now it's about basically unrolling it, getting organized. I wouldn't see the accelerator as being in a negotiating positions with suppliers. I think there are organized teams in organizations for that. But I do believe in the strength of working on specification and procurement guidance that can be rolled out. Seriously. Yeah.
I mean, I think we're almost at, there's one more question. I think we're almost at time, but I want to maybe highlight a few things that I heard from the two of you. I mean, I have a lot of other questions still that I would like to get responses to, but I'm sure you can have a chat with people afterwards. And those online, I'm hoping that you can actually take a look at the book that might have some of these anecdotes and examples of what MSF and has been working on. I think for me, I have a few takeaways that I find useful as one, being a co-coordinator of the Climate and Environment Charter, where we are working with organizations having the same questions, same challenges, and same, kind of dilemmas, right? One is, I think, really one of the things I took from is there are real and perceived trade-offs. You mentioned this, both of you mentioned these. There's what do we think are trade-offs, and actually when it comes down to the ground, if you really look at the cost-benefit analysis and really put that down into practice, those trade-offs are most often perceived. The real trade-offs will take a lot more time to solve, and we'll have to look at, like the challenges we face in terms of who takes these on. Are we really building and strengthening capacities? And if we are doing that, do we take away from that main core business of what we're meant to be doing? And this whole reset conversation is also like focusing a bit on that. And then the other one for me was really, the partnerships. I felt that really that is very key, and that links directly to the localization challenge and the how do we really look at local capacities, local knowledge, indigenous local knowledge. And, we at the Charter, we really are promoting a lot of that. Are we using our traditional knowledge in the past? I'm Sri Lankan, and some of the things you mentioned about putting a little prawns or, fish. We used to do that. We used to put fish in a paddy field so that you don't have too much mosquitoes growing, right? So these are things that were actually used in the past. The toolkit that you mentioned, really useful to tap into that. And how do we make sure that other organizations are also tap into these sort of toolkit and knowledge? And I think the other thing I took also is, how do we look at forecasting and really using that in our programming and planning to be pre-positioned, to be prepared, to be anticipatory. So when the time comes that we are not rushing pell-mell to try and actually, do some of these things. Pre-positioning funding, that is a challenge. And I think this is something that we as organizations here can advocate for in terms of, we have conversations coming up on the reset today with the IAC climate subgroup. Today is having a conversation from 4 to 5:30. This room.
Right here. Just stay.
Just
Don't
stay.
move. That way you're front row.
This same room. And then we are also, as a charter, is having a conversation on actually looking at financing and scaling resilience. Resilience is a bad word, but we are hearing this coming from our partners,
It's a good
local
word.
actors on the ground and actually doing action. That's 2 to 3:30 at room 4, just across the hall. You have your reset conversation coming up. Can you?
Tomorrow.
Yeah, tomorrow. What's the room? Where is it? What time is it?
So it's at 4 from 4 to 5:30. It will be in room Montreux, which is just across
Yep.
the
Across the CICG.
yeah, and
across
it's
the
an
road.
event which brings together donor agencies, ECHO and the Swiss Corporation, implementing organizations like ACTED and the Bangladesh Red Crescent, and also OCHA will be there to provide an update on the reset.
All
and
right.
That climate.
It's not in the morning anymore.
Sorry, it's at 11.
Oh,
So sorry,
okay.
I've got so much in my mind. Sorry.
Okay, so it's at 11. So we've got a few conversations to continue. And then for those in the room and for those online, the book in English, there's a link that's been shared online and there's a QR code in the room. You get 20% off for the English book. So
And the French one is 20% more.
this one, yes, you get a 20% off. So please do check that out. And I think one of the things that I also take away is that we really do need to look at, if we're to move the needle, the models need to change, our decisions need to change, leaderships need to take this really concretely. And I'm also for the fact that if we need to change a system, the systemic changes happens at various levels. There's a local level systemic change. We think of the system as international, but actually there's so multiple layers of systemic change that can happen and that need to happen. And I think we need to look at how do we advocate at all those levels, and advocating with the donors to really push the UN, to push there's a local level systemic change. We think of the system as international, but actually there's so multiple layers of systemic change that can happen and that need to happen. And I think we need to look at how do we advocate at all those levels, and advocating with the donors to really push the UN, to push governments to push their own systems, push civil society to push their governments, and then how do we at local level also change. So I'm going to leave with these thoughts. Any final nuggets of wisdom that you might want to impart with us?
Just, it has to be done, so let's do it. We all need to bring our grain of sand to the beach of possibility. It's not time to get depressed.
Yeah.
Action leads to hope, leads to action. It's a nice circle. Do what we can.
Yeah, no, I'll just give the example of Bangladesh that divided the number of victims of cyclones by 100 over the last 30 years, while having 3 times more cyclones than before, which is really, in my view, exemplary of actually what is the margin of maneuver when you want to tackle something. So that's one positive note. And the second is this is not just about management and planning, etc. It's also a battle of ideas. I think we shouldn't underestimate the fact that there are today political movements that are trying to dismantle climate action and are pursuing, you know, unashamedly heating policies, which are going to basically increase the problem. And it's time for, you know, organizations, especially those that are close to the most affected populations and services to populations, to really stand up and be clear on where they are and hold the course and actually not be tempted in this particular context to actually, because, you know, the resources are scarce, because there's war everywhere, etc., to actually look the other way, because while we'll be looking on the other way, the situation will anyway aggravate. So it's important to hold the course.
All right.
Careful, Moga.
Thanks everyone online and in the room. And thank you. Thank you. Yeah.